Making the case for case management. Case management involves facilitating the access of a patient to appropriate medical, rehabilitation and support programs, and coordination of the delivery of linkages. This role may involve liaison with various professionals and agencies, advocacy on behalf of the patient, and arranging for purchase of linkages where no appropriate programs are available. Case management differs from therapy in that the case manager is something of a broker-advocate. Many patients who need case management services but have difficulty advocating for themselves, knowing what services are available and coordinating those resources. Billing for these services is often tricky. In Florida, during the initial assessment we create a list of needed referrals. If the patient is capable of following up and making those linkages on his or her own, then the therapist assigned to the case merely follows up with the patient on the progress with the referrals. More often than not, by the time patients made it in for an assessment, they were in crisis. They were used to dealing with the mental health diagnosis as if it existed in a vacuum. Once they saw the logic to a comprehensive approach, they were eager to learn more. The first principle for anyone is that you have to have your basic needs met before you can focus on any sort of therapy. Adequate food, shelter, medical care and clothing and a feeling of safety are paramount. In solution-focused counseling, we often have clients identify where they're at. This is a 1. And we have them identify what their life would be like if things were going well. This is a 10. The next step is to figure out what small steps need to be taken to just get the person to a 2. Emotionally, FIS often means helping the person find some supports and some hope. Hope often starts to blossom once there is a plan of action in place. This is to be kept with them. Physically, many of our patients had dental and medical problems that had been untreated due to lack of insurance. Many also have no prescription coverage, so they were not taking necessary medications. Keep a list of the free and low-cost medical and dental clinics in your area. United Way Information and Referral also often has lists of charities that will help people with one-time medical expenses and can provide limited transportation to doctor's appointments. Also keep copies of medication vouchers in your desk. These can be printed out from the pharmaceutical company websites or websites such as xasis.org. It astounds me how few physicians assist their patients in linking with these resources. If the patient brings the voucher to his physician, it can be filled out in under 5 minutes and provided the patient with medication that is often free or less than $15 per month. From there, go back to the above website and search for the generic. It will give you a list of all of the companies who make the generic. For example, if you want to know who makes the generic for sertraline hydrochloride, search under S for sertraline. Once on the sertraline page, you can peruse each manufacturer's website for information about their particular prescription drug programs. This brings me to food. If your patients do not qualify for food stamps, or if the food stamps are not enough, you may need to work with them on reducing their budget. Chlorinated milk is cheaper than liquid. Beans, rice, peanut butter, crackers, oatmeal, ramen noodles are far cheaper than cheese and meat. Our food services director would buy these from the food bank each week at less than wholesale. You might also consider maintaining a food closet where people can donate canned and non-perishable goods. Additional referrals might include a victim advocate, a grief counselor from hospice, vocational rehabilitation, any local programs that rehabilitate cars and donate them to people in need. A Gene Shystop provide vouchers for subsidized child care, homeless shelter, temporary housing, housing and urban development to get on the subsidized housing waiting list and self-help support groups. Often there are many organizations in your community that can help with specific needs. establish a relationship with your local information and referral.